Okay, so here's the CT scan of a 20-year-old who got into ventricular fibrillation during a soccer match. And this is an ECG-gated CT of the coronary arteries. Just go through it and see if you can find an abnormality that can explain the ventricular fibrillation in this young individual. I'll just replay that. And I'll replay it again. It's right at the beginning. And now I'll go to the slide where you can see it. This is perhaps the most key slide of this CT scan. So let's look at the scan systematically. So this is a coronary CT orientation. This is the right side of the patient. This is the left side of the patient. This is the left atrium with the pulmonary veins entering it. And this is the left ventricle. This is the right atrium. This is the right ventricle. So left atrium, left ventricle, mitral valve leaflets, and this is the left ventricular outflow tract where blood is pumped towards the aorta. Now looking at the aorta, we can see that it is a tricuspid aortic valve, meaning that there are 3 cusps. And the typical cusp anatomy is that you have a non-coronary cusp right here, where no coronary artery arises from that. Then you have a right coronary cusp right here, which gives rise to the right coronary artery. And then you have a left coronary cusp, which gives rise to the main stem coronary artery, or left coronary artery. Now, where is this main stem? It is not originating from the left coronary cusp. What we do see is that the main stem originates from this cusp, which is the same cusp that gives rise to the right coronary artery. So this is an aberrant origin of the main stem. And not only is its origin abnormal, its course is also abnormal. It courses here between the pulmonary artery and the ascending aorta. And these are 2 high-pressure systems, so this causes compression on the main stem. And you can actually see that quite well here when you compare the diameter of the main stem in this interarterial segment and compare it to more distal segments, right here, the distal LAD, the bifurcation, and the left anterior descending, and the circumflex coronary artery. They are wider, so this is a form of post-stenotic dilatation. This is what we call a malignant coronary variant, and it's malignant because this compression can cause ischemia of the myocardium, and myocardial ischemia can lead to ventricular arrhythmias such as ventricular tachycardia or even ventricular fibrillation, as in this case with collapse and a reanimation. There are also other malignant variants. Another example is a right coronary artery that originates from the left coronary cusp, and this can also have an interarterial course, but you also have benign variants where there is no compression.